Okay, this is a brief tutorial about removing bile duct stones, one of the most common indications for an ERCP. Here's a schematic diagram of a stone in the bile duct. We're presuming that one has cannulated and got a balloon above the stone, having done a sphincterotomy. In my experience, this is one of the techniques in ERCP that is done actually most poorly, because of course the balloon is then drawn down with the stone into the lower duct. What one then often sees is that the endoscopist then pulls the balloon, and often in doing so pulls back on the duodenoscope in an effort to remove the stone from the bile duct. This then leads to the direction of traction of removing that stone to be lateral across the sphincter. That is very likely to lead to failed removal of the stone through the sphincterotomy. And so there are a number of steps that one needs to do in order to be sure that the direction of stone extraction is downwards in the line of the bile duct. And so a number of manoeuvres that we do here. Firstly, to advance, to slowly push the scope distally into a more causal position. We then so-called tip up with the big wheel on the duodenoscope. So tip up means thumb down. That then bends the tip of the duodenoscope towards the papilla, and one can only really do this manoeuvre if the balloon and therefore the stone are within a couple of centimetres of the tip of the duodenoscope. If the stone is higher up in the duct, this manoeuvre will not work. And so with the stone nicely distal within the duct, we have tip up and then a number of manoeuvres. Number one, tip down, which means thumb up, and that will put traction in this direction as the tip comes down, and then a very gentle clockwise torque and slight push in of the duodenoscope. And the effect of those manoeuvres is that the direction of traction of that stone is down the line of the bile duct with a much higher chance of stone removal.